has committed to end HIV and AIDS as a public health threat and teen pregnancies by 2030. Similarly, it is looking to put an end to sexual and gender-based violence by 2026. My name is Gloria Milimu, and on this episode of Health Digest, we look at the overlapping challenge of teen pregnancies, new HIV infections, and sexual gender-based violence, and how these three are affecting the achievement of these goals. In the sprawling slums of Dandora in Nairobi, we meet this 16-year-old girl, whom we shall call Umi. She spends her days figuring out what would become of her 7-month-old baby, and her studies that now hangs in the balance. In a way, her early motherhood is a metaphor for the responsibilities she unwittingly burdened herself with. But like the warrior she is taking it in her stride.
Nilipata mimba nikiwa 16 years last year 2022. Nikabidi niache shule juu wezi enda shule na mimba shule. So mimi sikuwa najua niko na mimba. Nilijua niko na mimba ikiwa na 7 months juu haiko inaonekana. So nilikuwa naenda shule lakini sikuwa najua.
Life has never been the same since the day she discovered she was expectant, she says. You see, Umi aspires to become a nurse someday. But what stands between her career aspiration and ability to lead a normal life just like her peers are the big shoes she has to wear as a mother to her daughter.
Imeniathiri sana juu hakuna mtu anaweza nisupport. Naona hii society tuko kuna stigmatization. Watu wanaona ukishapata mtoto hauwezi rudi shule kusoma, au yani wanaona maisha yako imeishia hapo. So mostly wanakwambianga, wanakuadvise tutafute mtu wako, unakaa huku kwa mama yako unampia shida ya nini, tafuta mtu uolewe, sijui nini, ushapata mtoto yako imeishia hapo, acha huyu brother yako mdogo aendelee kusoma. So imeniathiri sana juu napata hiyo stigmatization kutoka kwa society instead of kuni support. Yani wana discourage mpaka self esteem yangu inakuwa chini. So hata sometimes wakifanya example na behavior vibaya, wasichana wakifanya behavior vibaya ama watikane na vijana wanasema unataka kupata mimba kama nani.
While her peers are busy in school learning the basics of education and readying themselves for life and its peculiarities, Umi's early motherhood has forced her to see life through the lens of an adult.
Challenges zilikuwa mingi sana after kudeliver juu mtoto lazima apatiwe pampers, mtoto lazima yani hivi vitu ndogo ndogo lazima pia nikule vizuri, but ona sasa tuna hiyo uwezo. Mtu amedeliver lazima after si ataenda kunywa breakfast, lunch na supper, lazima kunywa breakfast, hapo katikati ya kule snack, then akule lunch, then hapo katikati ya kule snack. So si atakuwa na hiyo, atakuwa able. So mom kitu kama snack alikuwa ananibaya kama uji, ananipikia na kunywa ndo at least niko na hiyo nguvu, unaona. Then after kudeliver nilikuwa weak, yani nilishona nguvu kabisa, nikakonda hadi. So alikuwa anajaribu juu chini nirudishe mwili ndio nikuwe able kunyonyesha mtoto, na hata nikinyonyesha mtoto ashibe na pia mimi nikuwe tu sawa.
The disapproving eyes of her friends and the community at large has not made it easier for her to understand the uncertainty of the mountains she will need to climb soon. But still, like thousands of girls her age, they still face the emotional horrors of their actions as the society appears unwilling to walk these early parenthood journeys with them.
No feel bad sana. Unaona saa zingine unakufilisha vibaya kabisa, ama hata hao watoto huku ukitembea na mtoto anza kuangalia na sema una mtoto amezaa mtoto, ama hata ukienda clinic unaambiwa hivyo. Kuna rafiki yangu pia alipata mtoto, venye alideliver anaulizwa nani amezaa mwingine, ati mtoto amezaa mtoto. So unapata unasikia vibaya, instead of kuencourage venye utaleo mtoto wana kudiscourage ati mtoto amezaa mtoto. Hadi unapata sometimes utaki kutembea na mtoto wako juu watu wanakuchukulia vibaya. Unatembea na mtoto anashinda huyu mtoto amezaa mtoto, huyu ni mtoto wake kweli ama ni wa mamake. Yani na wanaongea ndio usikie, watu wanaongea ati pole pole, watu wanaongea na nguvu usikie ndio ikuumize. Kwa hivyo society inapenda yani kunini watu kufanya tu watu wanasikia vibaya, wanakupatia stigma. Ndo unakaa chini peke yako unajiuliza kwa nini nilifanyanga nini, nilikosianga Mungu wapi? Yaani unaona wewe ulifanya hiyo makosa yote. Yaani wakusupport kabisa. Ama hata uende kwa duka sometimes uenda kukopa pampers. Unaulizwa kwani huyo mtoto tulipata na wewe?
For this 20-year-old, whom we shall call Nancy to protect her identity, the script is all too familiar. At only 16, she has already become a mother of not only one, but 2 babies. The Form 4 student is not alone in these troubled waters. Here, life as it appears is lived on the fast lane, and young girls are the oblivious stars in a theater that is filled with lifelong bitter or sweet lessons.
Nilikuwa naona nimefail mamangu na babangu, hadi my brothers zangu na sistangu, but siku give up. Mamangu alikuwa ananipea hopes, ananiambia hapo si mwisho. Sasa nilikuwa najua hapo si the end, niko na life nyingine mbele. Beside kwa na watoi, niko na life, a better life hapo mbele yangu.
Place tunaishi ni watu wanakuanga hiveni, ukipatia msichana wenyewe mimba unakataa tu. Ni kitu obvious, watu wameshazoea. So mimi as for me mtu alikataa. At first alikuwa amekubali. So kuenda kwa marafiki, pia alikuwa shule, wakamwambia utaanzaje kulea mtoto pia uko kwenyu, mama yako ataliaje huyo mtoto, wewe fanya hivi, achana tu na msichana, achana na yeye, akae hivyo venye alikuwa. So kumpigia simu na muuliza tutafanya nini, anakuja ananiambia ati niende nitoe nikamwambia siwezi toa juu ni mimba kubwa, ni mimba miezi 7. Hata pia mimi marafiki zangu mostly walikuwa wanani-advise nitoe, ati wendo tu utoe juu sasa utafanya nini, wengine adiona mtu wako aende akukopea hiyo pesa uende utoe.
At only 19, this young mother, whose identity we are also not revealing, was already put in the family way. The challenges that come with marriage did not spare her either. Her young union was rocked by alleged cases of violence and infidelity.
I came to Dandora in 2016 after I dropped out of school in Form 2. So I was kind of struggling here. I don't have a mom. We weren't in good terms with my stepmom. So I lived a life. I met a man, decided to marry me. We stayed for a year, then we couldn't cooperate. The man threw me out of his house. I started struggling. So I was just up and down, and that's when I got my first pregnancy when I was 19. So when I was pregnant, I felt like the earth was coming to an end because I had nowhere to go to. So I even thought of committing suicide. Actually, I attempted suicide. Then I was sitting on a certain kibanda waiting for my death, but God didn't plan for that. So after I felt like I couldn't have a life because I didn't even have a proper place to stay, and now I'm pregnant. So I had to look for a way forward.
Juliana, also not her real name, only got to know about her HIV status last year. The results, she says, broke her heart in unimaginable ways. She felt betrayed, defeated, and alone, and unable to comprehend how her life had changed so fast.
Last year, November, the man threw me out of his house. Again, saa 7 ya usiku with my 2 kids. So I went to stay with a friend. When I was staying with a friend, it was like I just decided to go know my status. So when I reached there, I was like, I'm positive. That was my first test. I was like, no. It was a non-governmental organization. I was like, no, that kit you are using, I don't even trust the kit in the first place. Use the other one. Again, it was positive. I was like, seriously? How? I know myself. I go to my clinics because wamamwanaza tunapimwa like almost every time. So how? I failed to understand. Then kumbuka the man threw me out. So nilipata the courage. I went there and approached him. Nikamuliza ni makosa gani nilifanya? Was loving you wrong, or trusting you, or staying with you? What part of it is wrong? Why? And then if you didn't even care about me, you could at least cared about the kid, because the kid is breastfeeding. What if? Then the man was like, oh, stop crying. So what are you crying? It's life. Too many people are living positively outside here, and you can't even know. The problem is that they don't want to test themselves, whatever and whatever. I didn't even believe. I have already 2 kids, but I don't believe. I carried them with me. Then I took him and told him, let's go get tested both. Then he was like, oh, see, kutest ni so. I was like, no, you're not going to take me to the place I don't want to. I'm going to a public hospital. The only place I trust. We went to a public hospital. We both got tested. Again, I was tested with the 2 kids. I still wasn't believing any of the outcomes. Then I was like, okay, maybe mimi ndio niko na ebu test him. Then he was like, I could test. Even the counseling thing, the doc was like, then why do you seem like you know what you are expecting for an answer? Ati hapana, ni venye ni life, whatever. I was like, seriously? You're not even shocked that I'm your wife and I'm positive. You're not even shocked. Ile design ya, you're positive. That means umeni-infect. All that. He wasn't surprised at all. Alipimwa na kitu moja. Then nilikuwa naambia doc like, no. My husband can't be positive, because I never married a positive man. Do it for the second time. Then the man was like,
Juliana, Nancy and Umi are just but among thousands of young girls paying the ultimate price of the triple threat of new HIV infections, pregnancy among adolescents, and sexual and gender-based violence that curtails young people's fundamental rights to quality life, access to education and healthcare.
Mimi na kitu yenye serikali inafai kufanya ni una bado huku ghetto kitu nasumbua sana wasichana ni pads. Unapata hata mtu anatumia manguo. So unapata unaenda unaambia rafiki yako akusaidie pads. Maybe yeye wako na hiyo uwezo kidogo wa mama yake anaweza mnunulia. So ukimwambia kusaidia anakuambia wewe uko na siende utafute wale machali zako akubaie. Juu maybe anaona ngomeka na vijana anasema ni machali zako. Juu ukionekana unakaa na vijana unaambiwa wewe ndio uko na tabia mbaya. So unaambiwa ende ubaiwe nao vijana wenzako. Kwani mamako hawezi kubaia? So unapata msichana ameenda akafanya, maybe mtu akakuja akamwambia, kwanza huku wanaume wako na hiyo tabia, mtu ana convince akubaie pads ama akupatie 500 mlale na yeye. So wasichana wengine wanabai wazini wanaenda tu wanafanya bila kujua. So kitu inasumbua huku sana ni pads. Juu serikali inapeana pads kwa shule za government peke yake. So ingekuwa poa sana ikipeana hadi kwa shule za private. Juu private ndio watu wanasoma. Juu mostly huku private ni cheap. Private unapata school fees high school ni form 2 ni 3,900. So ni cheap kuliko government. Government ni 7,000. So watu wasichana wengi wako hizo shule. Na ni shule zenye hati watu wasomi yani. Yani nikao umeendea tu certificate juu unapata the whole day hata hakuna mwalimu ameingia juu hata hakuna mwalimu kila wiki ama kila siku mnabadilishwa mwalimu. Sasa hizi shule za private as growing.
Poverty is a major contributor to the triple threat, or rather a major promoter to the triple threat. By providing this sanitary towel, we are trying to prevent these girls to engage in transactional sex, or rather engage in toxic or unhealthy relationship, so they can be able to afford these sanitary towels. At this moment, we know there's high cost of living, and there's a family living on $1 a day, and it may be impossible for this family to provide sanitary towel to this girl. So the reason why we tend to provide this sanitary towel to these girls is promote 100% retention of these girls in school, so they can be able to access the quality education that we are talking about.
According to the National Syndemic Diseases Control Council, about 99 new HIV infections occur among children aged between 10 and 19 years every week. In 2020, this demographic contributed to 15% of all new HIV infections that year. This means at least 2 out of every 10 people diagnosed with HIV then were children between that age bracket. Similarly, cases of sexual and gender-based violence among adolescents aged 10 to 17 years in 2021 was 16,476, or 42% of total sexual and gender-based violence cases reported during that period. When it comes to teenage pregnancies, at least 260,000 of all clients who attended antenatal clinics in the country were children aged between 10 and 19 years in 2022.
Over the years, we have reported very good progress towards our response against the HIV and AIDS situation in the country. However, as we go to the last mile of our commitment to end HIV and AIDS as a public health threat by 2030, we have been concerned by the unproportionately increasing number of new infections amongst young people and adolescents. Unfortunately, this is within the same cohort that we see practices that drive up new HIV infections, what we call as endemic factors. We have seen an increase in the numbers of adolescent pregnancies that are seen in our health facilities across the country. And also, we have a disproportionately high prevalence of sexual and gender-based violence that is affecting this age bracket. So what we did, Gloria, is that we came together with other state and non-state actors who have a mandate towards ending either adolescent pregnancies, sexual and gender-based violence, or new HIV infections. We came together and broke our silos, and we said we must work as a team in a multi-sectoral response, because these are systemic factors which affect and exacerbate the occurrence of each other.
Experts say the overlapping challenge of new HIV infections poses a threat to the attainment of the goals Kenya has committed to in ending the three vices. They explained that the triple threat presents a complex web of vulnerabilities that affect the well-being of adolescents, especially girls.
We got ourselves in a situation where you have a population of young people who are currently practicing quite an unacceptable amount of unprotected sexual encounters. And those sexual encounters not only lead to possibilities of HIV infections, but also possibilities of getting infected with other sexually transmitted infections, such as gonorrhea, syphilis, herpes, and the rest.
Wasichana wakipata support, wengi hawataenda kwa zile vitu zina happen sahi hapa. Wanataka tu support ya kukuwa na mtu wako free kuongea na yeye. Sasa kama niko na shida naweza kuja kwako, najua niko free, naweza ongea na wewe, unaweza nisikia unisaidie. Na kuna mwenye naweza enda kuambia akatai.
As well, they advise on the need for collaborative solutions to tackle the triple threat scourge.
We started a dialogue of using in the national government administrative officers as community gatekeepers who can enable us to disseminate this information to the lowest level of our communities. And this started last year, where we recognized that among the national government administrators we have across the country, there are about 12 to 13,000 chiefs and assistant chiefs. Below them, we have the village elders who also work closely with the Nyumba Kumi initiatives. So we have been on a program where we are sensitizing these community gatekeepers to play a leading role in ensuring that within the communities they come from, individuals, families, and communities are sensitized and have the knowledge of the threats that are posed by these three challenges we have mentioned.
In its effort to tackle the triple threat that reverses gains made in combating new HIV infections, teenage pregnancies, together with sexual and gender-based violence, the Ministry of Health through the National Syndemic Diseases Control Council says it has leveraged the community health strategy, which brings on board about 100,000 health promoters and government administrative officers. These teams are expected to help create awareness about the effects of the three at the grassroots level.
We have come up with the uniform, standardized training curriculums and information packages. And we have identified 3 master trainers per county, leading to a number of 141 across the 47 counties. We are training these master trainers. They are composed of 2 assistant county commissioners per county and 1 community health strategy focal person. When they go back to their counties, as from the month of July, these officers who have been trained as master trainers on ending the triple threat will go and train another 30 trainers of trainers from the various sub-counties. These 30 trainers of trainers will be empowered with the information packages through which they will use to sensitize the lower levels of community gatekeepers.
The program has been launched in at least 26 counties.
Certainly, the urban areas seem like the counties of Nairobi, Nakuru. When you go to the rural counties, you find counties like Homa Bay, counties like Siaya, counties like Migori, counties like Kisii, Uasin Gishu. They have, fairly larger numbers than the rest of the counties in terms of the occurrence of these 3 syndemic conditions. However, what we have noted, and this was demonstrated through the Kenya Demographic Health Survey of the year 2022, the traditionally low prevalence HIV counties, particularly the counties of Northeastern. We are talking about the counties of Mandera, we are talking about the counties of Wajir, we are talking about the counties of Marsabit, we are talking about the counties of Samburu, throw in there Turkana, Lamu, Tana River. The trend that we have seen is that there is low awareness of issues around HIV. There is low awareness of one's HIV status in those counties, and a point of concern is also the rate of mother-to-child transmission of HIV in those counties.
Similarly, this increment has been attributed to COVID-19 pandemic that weakened the country's health systems. Now, experts warn that should there be another hit on the country's health systems, the country is likely to renege on the gains made. Overall, in order to create a healthier, safer, and more empowered future for the likes of Umi, Juliana, and Nancy, and thousands of other adolescents and young adults at risk of triple threat, collective action is paramount. Gloria Milimu, KTN News.